Good morning all. Today we are speaking about the important skin disorder, psoriasis. The big population has been affected by this disease. First of all, we'll try to understand what they mean by the psoriasis. Psoriasis is an autoimmune skin disorder which affects the skin layers. In the skin layers, usually the dead cells of the skin replenishes within 28 days of the cycle. But those in cases of psoriasis, the shedding of the dead cells occurs within 5 days. So production of the cells tremendously increases in the disease of psoriasis. Because of this, there is accumulation of number of dead cells on the skin, and these skins look like silvery scales. Now we'll try to understand the psoriasis basically on which locations it occurs. It occurs on the scalp, it occurs on the body, on upper arms, legs, extremities, abdomen, anywhere, and the palms and the planters. Now if we try to understand, there is an excessive accumulation of dead skin cells on the skin gets dried, and because of dried skin cells, the other symptoms like itching appears. Because of the itching and the dryness, eventually the cracks occurs, and through these cracks we can see the bleedings comes up. Once it starts bleeding, it gets thickened, it gets healed with scar tissues, and eventually there is a thickening of the skin. This dead skins gets accumulated over the body. This is the general concept of the pathology what occurs in the skin disorders of the psoriasis. Now we'll try to understand why anybody gets psoriasis. The cause for the psoriasis is still unknown, but it has been identified in the practice that genetic factors or the presence of autoimmune disorders is available in the history. At the same time, the person who has been passed through certain stresses also are more predisposed to the psoriasis. Other environmental triggering factors are, one is where the different drugs is been taken for a longer duration, and skin traumas. These are certain factors which are responsible for the development of this psoriasis. Now, if the psoriasis has not been treated for a longer duration, it may give rise to certain complications. Like it also affects the joint called arthritis. It is also known as psoriatic arthritis. Because this person is passing through a certain illness symptoms of itching, the person may affect with the symptoms like depression. Now, the psoriasis is being treated homeopathically in our center at Dr. M.L. Dhawale Homeopathic Hospital, Palghar. We have the specialized skin OPD since last 25 years. Apart from the psoriasis, we have treated many other skin disorders. We are treating the psoriasis in our skin OPD by taking the complete history of the person, and then we try to identify his personality at the level of mind and the body. In homeopathic medicines, they are there having their personalities which matches with the patient's personalities, and the medicines identified on the basis of the history has been prescribed, which helps to treat psoriasis. We have seen that there are a number of patients who have been treated by this system successfully. Psoriasis is been prevented by using a different lifestyle. This is, since we have identified the stresses are a major cause of concern for the development and maintenance of the disease, it can be prevented by adopting a healthy lifestyle, regular exercise, and meditation. All these factors will help to relieve the stress, and then it also helps to maintain a healthy life during the psoriasis.